Hi, everyone. Thank you for joining. Right now, we're talking about another video in our series about Medicare for veterans and federal employees. So, again, my name is Jonathan Schinkel. I am the owner, primary agent of Health Horizons Medicare Solutions. We're a full service insurance agency, a brokerage, meaning we work with every insurance plan, specializing in health insurance and Medicare. Also, do life insurance, final expense, annuities, and things like that. But our expertise in our field is very much in the Medicare space. And so today we'll get into it. Medicare for veterans. First of all, thank you so much for your service. We're grateful on behalf of our country, the people of the United States. Thank you for your service. We really do mean that. TRICARE for life. If you are a retired military service member where you fully retired, you and your spouse are eligible for what is called TRICARE for life. Now, at age 65, your TRICARE will automatically convert to TRICARE for life. They will contact you, send you lots of information, things like that. However, you must add Medicare Part A and B as well. So if you have deferred Social Security, again, past 65, look at our previous video of when to sign up, important dates to be aware of. If you took Social Security at age 62, age 64, you're going to get Part A and B of Medicare automatically. However, if you deferred Social Security, you have not signed up for it yet, you must do that. Either add on Parts A and B and tell Social Security you want to continue to defer your payments or start receiving it at age 65. But you must be proactive. You must contact Social Security to sign up for Medicare Parts A and B. Otherwise, you will be ineligible for TRICARE for life. Now, what does TRICARE for life offer? Well, TRICARE for life is basically the best of the best. You have robust coverage. You should pay nothing for Part A and B medical services, hospitalization, outpatient medical care, everything we've described in this series of Medicare videos about what Medicare offers. You should receive the 80% paid for by Medicare and the full 20% paid for by TRICARE. That's the way the program is set up for work. Again, set up to work, rather. Again, thank you for your service. And that is one of the rewards of a career in the military. Now, you do not need to add on a Part C Advantage plan. However, you could gain many extra benefits if you do. Many of these Advantage plan companies now have designed plans specifically for veterans and their families. They include no drug coverage because TRICARE for Life provides your prescription drug coverage for you. Therefore, these plans do not interfere with TRICARE. These plans, however, will offer some additional things beyond what Medicare and TRICARE covers that you can greatly benefit from. Things like robust dental insurance allowance, a lot of money every year to be able to go spend on dental work, vision allowance, hearing aid coverage, money back to your Social Security check. Many of these plans are offering a rebate on the amount that you pay for your Medicare Part B. It's either taken out of your check or that you pay directly. Again, you have to pay Medicare Part B to get TRICARE for life. So why not get some money back as a rebate on that through one of these plans? Additionally, some plans offer the grocery allowance cards and the Silver Sneakers, a gym program that gives you free access to many gyms and fitness centers. Now, if you're a veteran who uses the VA, a very similar situation. Those who are eligible for VA, however, are not required to add Medicare Part B. That is the major difference. But the VA does recommend that you add on Medicare B. And of course, you will need that to get a second opinion at a civilian doctor's office outside of the VA. You also, as a VA beneficiary, need to know that if you get care at a civilian hospital or an outpatient center, like an emergency room or urgent care center, have them contact the VA, and oftentimes the VA will cover most or all of your share of the cost. It's important to talk to the VSO and find out what the coverage is in your area for the VA, what the requirements are as far as how many times a year you must see your primary doctor. Usually it's one primary care appointment for a year to maintain coverage in the VA healthcare system. You as a VA member would also greatly benefit from a Part C plan by receiving the benefits that I just described. Now, as a VA member, you of course go into the VA. VA does not work with Medicare whatsoever. So there is no billing complication or anything like that. VA takes care of their end. If you go to an outpatient civilian doctor, you can have them bill the VA directly. If there's any outstanding share or things like that, they can send it to the Medicare Advantage insurance company. TRICARE, on the other hand, does change the billing arrangement if you add on a Part C plan. This is important to understand. Doesn't mean don't sign up for one. I have plenty of members that I've helped over the years who use TRICARE for life. I lived in Norfolk, Virginia, largest Navy base in the world. Many other military facilities around there, a lot of retired military. So I've helped a lot of people with TRICARE get one of these honors type plans, and it works flawlessly. However, it's important for you to understand that the plan becomes your primary, just as Medicare was primary. TRICARE remains secondary. If the plan has a network, that means that if you go outside the network, then TRICARE may not pay that full out-of-network coinsurance if it's more than the 20% that TRICARE would typically pay under Medicare. So if your Medicare Advantage plan offers out-of-network coverage and it's the same as in-network coverage, no difference in cost, that's great. By all means, you can see an out-of-network doctor. If your Medicare Advantage plan that you pick has 30 or 40% coinsurance out of network, that means you could be on the hook for that amount above the 20% that TRICARE would normally pay. Just something to be aware of. Also, the Part C plan does not forward your bill onto TRICARE automatically. Your doctor's office needs to complete that step. This differs from your current arrangement where Medicare does that automatically. Your doctor's office instead will have to forward your share of the bill to Wisconsin Physician Services, who manages TRICARE for life. Typically, the doctor has no issue doing that. They do that all the time. Shouldn't be any issue at all. But something for you to be aware of the way that that works in case you get a bill, you need to go back to the doctor and ask them, hey, remember, I have TRICARE. Did you submit it to TRICARE? Oftentimes the doctor's like, oh, no, sorry, we didn't realize that or forgot. We'll go ahead and take care of that. Don't pay us the bill. And then, as I mentioned here at the bottom of this page, regular VA healthcare does not coordinate with Medicare, but the VA will pay your share of the costs if you notify them promptly after receiving civilian healthcare. All right, so that concludes this little short video on Medicare for veterans. Again, Jonathan Schinkel, primary agent and owner, managing partner of Health Horizons Medicare Solutions. Please feel free to contact us, browse our website, send us a message, phone call, text, email. We'd be happy to set up a time to talk with you about your situation and help you navigate this complex situation of Medicare. Thank you so much.